Hello, everyone. My name's Sherilyn Knapp, and welcome to Managing Workplace Conflict series, Navigating Through Conflict Tutorials. I'm going to start by telling you a little bit about me. Uh, and I want to say thank you to Doctors of BC and the Business Pathways program for including me in the conversation about how we navigate conflict in healthcare workplaces. I'm located in Victoria, British Columbia, on the traditional unceded territories of the Lekwungen speaking people. And I want to acknowledge that and express my gratitude for being able to work and connect with you from this place and acknowledge the relationships that those people have had with the land since time immemorial. I am a little bit about me. I'm a lawyer by trade, and I practiced civil and employment litigation uh, for 15 years in Ontario before coming to British Columbia and Vancouver Island. Since 2019, I have a mediation practice or a conflict resolution practice where I do a few different things. I I'm a civil and workplace mediator. I am also a workplace investigator, so sometimes I'm called upon to look into issues of bullying, harassment, and discrimination in workplaces. I work with people on conflict resolution in workplaces and organizations. So sometimes that's providing training or coaching or facilitation to work with people around how we do conflict. The place I come from in terms of this work is wanting to really work with people to understand how conflict operates and how we can all improve our skills for how we navigate conflict in a time in healthcare, in the medical system, for physicians and the people physicians work with, at a time when things are stressful. And so having some additional skills to help navigate some tough situations can be helpful. So that's a little bit about me. And next we are going to turn to start the tutorial. Let's start with a short disclaimer. This tutorial is for educational purposes. Every conflict situation is unique. The strategies suggested here may not be suitable for all circumstances, and this tutorial does not constitute professional advice or counseling. Do seek advice from a qualified mediator, counselor, lawyer, or other professional for complex or sensitive conflict situations. The creators of this tutorial shall not be held liable for consequences arising from use or misuse of the information provided. Welcome to the Managing Workplace Conflict series, Navigating Through Conflict Tutorial C. In this tutorial, we're going to focus around the concept of drama triangles and getting hooked into other people's conflict and maybe sometimes contributing to an increase of conflict quite unintentionally. Uh, so, if you would like more detail on the concepts that we talk about in this tutorial, you can check out the Workplace Conflict Resolution Foundation's webinar that was recorded on February 16th, 2023. And it is available through the Business Pathways program. And that's about an hour long, but it's a way to pull together all of these concepts that we're talking about through the tutorial series. So I'm going to talk about the drama triangle, and then we're going to apply that to a scenario involving hospital dynamics. Now, you can read up on drama triangles, through um, resources around psychology and family systems and workplace systems. And I'm going to just give a very short introduction to the concept, which you may have heard of already, or some of you work with it all the time, and some of you this might be a little bit new for. And so the idea is that when there is conflict and drama, that there are actually three participants in it, not just two. And so there's a person who sees themselves in the victim role. And they might be overwhelmed by their own vulnerability. They might not be taking responsibility for their own contributions, and they're actively blaming others for what's going on. So the person who they're blaming, you might call them the villain or the perpetrator, and usually that person might be unaware of their own agency, and they can be using power in a negative and destructive way in a dynamic. But interestingly, at the same time, the villain often actually feels like the victim. So um so you've got a villain who feels like a victim, and they're um inferring some intentionality on a person who they uh, see as the perpetrator or the villain. And then you've got the switching of roles in the drama triangle all the time. I really want to focus a lot on the role of the person who's the rescuer. So the rescuer in the drama triangle w- has a gets involved to save the people that they see as vulnerable. They often offer unsolicited help, and they are at risk of becoming a negative advocate in somebody else's dispute. And it's tricky dynamics. And so you can, maybe think back to your own family of origin if you come from a family with some complicated dynamics, or think back to workplaces where the conflict was really escalated, and it wasn't like not one where health conflict was done in a healthy way, where people sort of talk about their differences and sort them out and move forward and get creative about it, but places where there's a lot of destructive drama, and maybe there's drama triangles going on. So let's think about that in terms of a scenario. So this is a scenario that I've heard of in multiple situations. It comes up in the kind of work that I do. So it's not uncommon, and I think that people can be coming from a pretty well-intentioned place when this happens, and it's acknowledging that the underlying stress in the system that is making a lot of people feel brittle. So here's the hospital dynamic scenario. So Mita, a physician who regularly works with a team on a hospital unit, um, and nursing and allied health staff have been complaining to Sumita about their clinical lead, Pat. Sumita has heard several stories about how Pat is autocratic and targets team members for mistreatment. Sumita likes working with this team and hates to see them in distress. Sumita thinks Pat is clearly problematic, and Pat's behavior is distracting the staff, which could negatively impact patient care. Sumita decides she has to be a supportive colleague and advocate for her nursing and allied health colleagues by confronting Pat about Pat's poor leadership. So, in some ways, this scenario has similarities to other scenarios that we've looked at in the tutorial series, and it's really thinking about when you're being um, potentially hooked into somebody else's situation. How do you handle that? And I want to say that it's normal for people to vent to us about their frustrations. And the question is, what do we do about that? And so the discussion question I'm asking is, how do we sometimes exacerbate conflict even when we mean well? And so, what I want to start with is the idea that, yeah, strains in the healthcare system are distressing for everybody. They're distressing for the physicians that work in the system, for the people who support them or support the system and work in clinics, or stressful for the people who work in the hospital system. And I regularly work with people in healthcare and see this playing out. So to just like acknowledge that distress is real, and as physicians, it's really normal. It's physicians and professionals, frankly. You don't have to be a physician to feel this way. That when someone comes to you, it's really normal to want to help when we see something that sounds unfair. Um, and maybe in a situation where we feel like we have not enough control over things we wish we had control over. Maybe it helps us feel better by trying to have control over something that maybe we think we can control. Um, from my perspective, thinking about different conflict styles. Sometimes people avoid conflict resolution conversations and vent to others instead. And you hear this, right? There's a lot of talk in hospital healthcare settings, particularly, but also in other types of larger facilities, about brewing issues that remain unaddressed and and gossip and chatter. Like, it's called gossip, and it's interesting because I've had to wrap my head around what do we mean by gossip? And I think what we really mean is the kind of chatter that happens when I go talk to somebody else about my issue instead of talking to the person that I have an issue with. Or maybe when I went to talk to the person I have an issue with, maybe that conversation didn't go well. So I've stopped trying that. And I just go and vent to other people instead. So, conversations that I have in my work, helping various types of programs and units, whether they're in hospitals or not, about how to handle these dynamics is that that chatter, that gossip, that venting is actually seen as quite toxic. It becomes quite toxic and problematic, and really brings people down, and then people don't want to come to work, or they want to move on to a different workplace because it's that hard to be around. So it's on the one hand, it's normal for people to seek support from others who agree with them. Like, if I go to talk to you about something I'm concerned about and you agree with me and say, "Oh yeah, I can't believe that. You're being really mistreated. Poor you. Pat sounds like a real devil." Um, then I'm gonna, I feel initially validated that, yeah, right, Pat's the problem and I'm not the problem. And so I feel validated in this situation that I've been wronged. But you might notice that that contributes to adversarialism. It does not assist with problem solving. And so a triangulated dynamic of victim, villain, and rescuer increases blaming and defensiveness. Because if so in our scenario here, if the colleagues are talking to Sumita about Pat, and Sumita says, "Oh yeah, you're right. That's not right. This needs to be changed. The healthcare system's terrible." Then what that's doing is further separating, really contributing to the victimhood of the people who are experiencing difficulty with Pat, and villainizing Pat as the problem. And maybe there's other dynamics at play that would benefit from a problem solving approach as opposed to this polarized adversarial approach. The second question, then, the second discussion question to explore is, so what's the plan? Like, how do we address this conflict? And my suggestion is for Sumita to think about using conflict resolution communication skills to demonstrate active listening to her healthcare colleagues and ask curiosity questions without taking sides. That doesn't mean trying to fix it, it just means talking to people in an engaged way, using those three key communication skills of active listening, asking curiosity questions, and then from time to time expressing uh, with I statements to to just engage with people in a conversation that helps them feel heard without contributing to the polarization. And so that means remaining mindful of the damage that polarization can cause in healthcare workplaces. There's a lot of us and them happening in healthcare workplaces right now. There is moral distress over problems in the system to meet the complicated cases that systems are supposed to be dealing with, and there is a desire to cast blame. When people in those workplaces are blaming each other, they're not able to find the solutions for how to move forward or how to work together for advocating for the kind of change that they'd like to see in the system. If they're fighting each other, they're not improving the system. And so, my suggestion for Sumita here is to really resist identifying anyone as a victim or a villain and avoiding stepping into the rescuer role. Um, and at the same time, Sumita is an important colleague to these people. They probably look up to her. There's an opportunity to be a good role model when it comes to conflict resolution. And so that might mean also considering alternatives to staying out of it entirely. I mean, an option is to say, you know what, this doesn't have to do with me. You go work it out. But and that might be understandable. That might be where Sumit is at. She's got too much on her plate already. And I'm not saying there's anything wrong with that. And if Sumita had some bandwidth to say, okay, well, I've been hearing about this for a while. I'd like to be involved, right? What's an alternative Samita going and confronting Pat to say, you know, I hear you're a bad leader and you're contributing to things being terrible and stuff needs to change around here. Could Sumita instead be a good role model of conflict resolution mindset by encouraging the staff to consider options for how to collaborate with Pat to brainstorm solutions for working together differently. And if you've listened to the first two tutorials, maybe you're hearing something similar in these themes, right? But the idea is we use some active listening and some curiosity questions so people feel heard and not dismissed, and then move to the point where it's like, how do you want to see it going forward? And some structured brainstorming to help people generate options. And what that might sound like is, okay, well, what, I hear you saying you're having some trouble with Pat. What are your options right now? What are your options for how to proceed? And the people might say, oh, it's not worth it. I'm not going to do anything. And Sumita can say, well, yeah, that's an option. You're right. Let's think about some other options. And so that's a way to move past arguing with somebody about whether they should do nothing and instead saying, okay, well, let's put that one on the table as an option. And I don't know, I got 5 minutes. Let's sit together and let's just brainstorm some other options for how to handle this difficult situation because it sounds important. And in that way, I it is my view, it's my perspective that we can all, no matter what role we have in in a workplace system, in an organizational system, in healthcare, we can role model good conflict resolution. We can help build capacity in each other because we all need support in uh, in our day-to-day work, no matter who we are, um, that we can support each other to say some things, feel heard in a constructive way, and then move towards solution building, which, might mean having to bring it up with leadership or might mean trying to have a difficult conversation with somebody that somebody's been having run-ins with. But us getting involved in trying to fix it for other people doesn't build capacity. It and can end up backfiring for the whole situation. It can end up backfiring for those of us who tried to insert ourselves and become involved as the rescuer in the drama triangle. And it can also backfire for the whole workplace in a way that wasn't ever what was intended. So, with that in mind, I want to refer you to some resources that I have found helpful. If you're wanting to do more reading on conflict, you can think about some books that I have read that I find helpful, and they are called "The Joy of Conflict Resolution," "Difficult Conversations," "Style Matters," the Crable Conflict Style Inventory, "No Ego," and "It's All Your Fault at Work." And the highconflictinstitute.com is also a resource that can be helpful for unpacking and understanding really high conflict, difficult situations. I want to thank you for listening and thank Business Pathways for sponsoring and putting together the series of tutorials. My name is Sherilyn Knapp. You can find me at knappresolutions.com. And as part of the Business Pathways program, I physicians who are members of Doctors of BC are able to connect with me to talk about conflict resolution services. And actually, there is a as a as a roster member and part of the Business Pathways program, there's a preferred pricing program there for members of Doctors of BC. So you can look more into that or contact me to ask me questions. Thank you again for listening, and I wish you all well.